What we used was an algorithm called PECARN to decide in the setting of minor pediatric head trauma when using head CT was appropriate. So we took an existing algorithm and implemented it right into the EMR for our physicians to use.
So PECARN helps us decrease unnecessary radiation doses to children after trauma by using evidence-based guidelines. And this brings those guidelines to the forefront for the practicing physician to decide whether it's appropriate to get the study and not reflexively order it because of a trauma that may have happened.
The interesting thing about the PECARN algorithm is that it really takes us to the next step in decision support. CDS helps physicians to decide which of the study they've ordered to implement, whereas PECARN algorithm actually helps physicians decide whether or not the patient needs a study at all.
For sure, I think PECARN is the beginning of the next generation of clinical decision support. Physicians are asking now, why isn't the system telling me I should do X, Y, and Z? Why isn't the system giving me more information to take better care of my patient? So I think this is a real opportunity for us to say, look what we can do, and then be able to blue sky on what we're going to be able to do in the next 5 to 10 years.
I think PECARN represents a very important step in terms of using clinical decision support, in that ideally it will extract from the EMR those data elements unique to that patient and allow a clinical decision support decision be made based on that particular patient's unique either clinical findings or laboratory findings that allow a very patient-centric clinical decision support result.
We are now providing transparent, reproducible recommendations, whether it's for the appropriateness of a study and potentially in the future, the appropriateness for when to order the study.
And it really helps to guide decision making and allows us to understand what the right modalities are. And in a teaching institution, it's especially important because it allows our residents to have a better understanding of what they're going to be doing when they're out and they've finished training and the best way to treat their patients in the safest ways.
So it's critical in accountable care organization and population health payment models that we not only practice evidence-based medicine, but that we reduce unnecessary testing and services. And I think PECARN shows that we do have a path to get there.